All right, Terrence, I think if you want to go ahead and start, I think we're good.
Good deal. Good afternoon, and thank you for joining us on our May 7th, 10 to the Top Chat. I want to thank the ones of you who are new to this chat and also the ones that have been on multiple chats. I would be remiss in not thanking Dean and his team for putting this format together for us. I think it's important as an upstate region for us to stay connected and to hear things that are relative to the pandemic and our response to that pandemic. And we've been very creative on some of the guests and speakers that we've had to inform us about what's going on in not only the upstate region, the state, and the nation. And more importantly, I think it's been very beneficial to hear specific people in the 10-county region talk about the successes and the challenges that they have in their community. So with that, I will get us through the agenda, and I'll talk to you on the back side of this, and I'll turn the meeting over to Dean. Dean?
Great. Thank you very much, Terrence. And we have just a very quick update from a 10 at the top standpoint. As Terrence mentioned, we've been doing these now for over a month, and we plan on having this weekly call through at least the end of May, and then we'll kind of readjust and see what's going on, as many of you probably have been as well. I've been on a number of conversations and calls lately where people are talking about, how do we move forward? In some cases, reopening facilities and things of that nature. And of course, for us, being that we are not a direct service provider and our physical location is not necessarily where we do most of our efforts, we really have not stopped being engaged in working. But like everyone else, we're trying to figure out when there might be opportunities to kind of move back to some of the things we've done more in person and things of that nature. Our plan right now in terms of for our in-person type meetings is we have a couple scheduled for mid to late June that we hope will be able to happen in person. However, we're certainly going to stay flexible and look at the CDC regulations and other recommendations for participation and engagement. And we will probably keep some level of a TATT Chat type of program going for a while, but maybe not at the same weekly consistency that we've done with this. Aaron will talk about the entrepreneur ecosystem in a few minutes, and we've had weekly calls there, and we're going to transition from those after the one this week. So that's kind of where we are. I've talked before about the county listening tours. We have a couple of those now scheduled, and I'm going to, if Sharon is on, yes, she is here. I'm going to turn it over to Sharon, and she's going to share real quickly about the peak and about the county tours. So Sharon?
Hello. Yeah, so the peak, I think we talked about the peak last week, that we have pushed it back again, just not knowing where we're going to be in terms of large groups by June, which was when we had pushed it back to. We've pushed it now back to September 14th. The programming is a little bit fluid right now. I need to get together with my committee again to just decide what we want to do exactly in terms of the panels that we had planned, whether or not we want to really change those dramatically or just tweak them or what. So that's still a little bit fluid right now. In terms of the listening tour, I've been in touch with most of, I think I've been on the phone with just about somebody from all of the 7 rural counties. And we're trying to get those scheduled for late May. I understand that trying to get them scheduled for the beginning of the month, people felt that they were still kind of in the weeds of the actual crisis and not ready to transition to recovery. So, but we're trying to get those scheduled, and as Dean said, we do have a couple. So what we want to do is just listen to you, hear what your challenges and concerns are, and look for some commonalities and how we can kind of address those on a larger scale.
Great. Thank you, Sharon. And as I mentioned, we will send those dates to everyone once we know them, and anyone is welcome to be on the call and hear that and be part of that conversation with some of the key leaders in each county. So today we have a great set of stakeholders. For those who are new to the call, we've tried to have kind of some sector updates, both a combination of looking at the COVID-19, but also looking forward at what's happening and what the future looks like in some sector areas. So we're very appreciative today to have with us Elizabeth Freeman, who is a professor at USC Upstate, an award-winning professor at USC Upstate, just received an award this afternoon and is gracious to be with us. She spoke to the entrepreneur group a week ago and is going to share just, what I'm sure everyone is having the same experiences as we are, that, it's not just about physical and, performance and keeping your organization running and your business running. It's also the mental game of having a very significant disruption to your daily routine and schedules. And so, I think as we move forward in this and you look at your employees and your folks you engage with, any tips on how to keep everyone's mental health as strong as possible is certainly important. So with that, I will turn it over to Beth. Thank you.
You're welcome. And thank you for having me today. I look forward to sharing these different tips that we have for staying mentally healthy during this time. So next slide. As Dean mentioned, I'm Elizabeth Freeman. I go by Beth. For those of you who have looked me up, and I tend to refer, or people who are friendly with me, you'll find that I'm associated with the USC Upstate's Department of Psychology, where I have been for 17 years, very happily and engaged and giving back to our upstate community. If you want to reach back to me later on, my contact information by email, and 2 phone numbers are included there as well, an office number and my cell number. Feel free to reach out either way. Next slide. Our topic today is mental health tips in our current new normal. How we want to address being at peace and being aware of what's going on around us so as we can contribute to moving forward and making progress. Next slide. So let's start first with a definition of what a current new normal means. From the perspective of this next 10 minutes that we share together, the definition is that new normal is about adjusting our lives to the reality of COVID-19. Now, if you think about it, adjustment goes in a lot of different directions. It means adjusting our finances, adjusting our lifestyles, adjusting how we approach life, how we interact with other individuals. But, next slide. Going to the next slide. By having the current in front of that definition, it means that it's going to change, and that what is current today and what we need to do to adapt today is not necessarily going to be what we have to do going forward. So when I was putting these 10 minutes together, these insights and tips for you, I wanted to make sure that you have something that will be applicable for not only the current new normal, but the future going forward. So that I want you to think about these tips as being permanent mental health tips, as opposed to being temporary and useful just for now. So the very first thing I want to emphasize with everybody today is that when we think about mental health, we have a tendency to separate physical health and mental health. But the reality is, health is both physical and mental. Ultimately, anything you do that promotes physical health will also contribute to your mental health. It contributes to all of our mental health. So, next slide. The first tip that I leave for you is not to separate mental health from physical health. With that being said, when we start to think of everything we do physically, that we are trying to do this to be physically healthy and that to be mentally healthy, that it isn't necessary to try to separate the two. I do this to be calm, I do this to be engaged, I do this to be aware. When you are active, when you are practicing good physical health, you are contributing to your ability to cope and move forward. So that's our mental health tip. Number one, try not to separate the two. Think of your health as an integral process rather than a compartmentalized. Next slide. The second thing I want to bring up is that we study physical health systemically. We think about our cardiovascular system, our digestive system, our muscular system. We think about our vision systems and our auditory systems. And I think that's useful for us because it helps us manage the different, a sense of overwhelm, breaking it down into understandable segments. So since we are already well versed in understanding systems of health, let's take that system and apply it to the way we understand our mental health. And so I'm going to suggest to you today aspects of understanding mental health systems that I do not read every time I go in and I look at the internet and I see that they're giving us 10 best practices to do this, or 5 best practices to manage your stress, or 3 things that will make you happy. I think that while those are useful and they are certainly easy to understand, they are not new and they are not really addressing what we need at a deeper level to understand our mental health environment. So next slide. I suggest that our mental health tip number 2 is that we learn how to understand our individual or the personal mental health systems. And of course, that sounds like a lead-in, doesn't it? Or sort of like a tease building up for something. And yes, that's true, because our next topic for the next slide is that our mental health insights, that our different mental health systems can be broken down into 3 categories. And the first is that of a sense of self, a sense of person. Secondarily, a sense of others, a sense of group, if you will. And then third, a sense of community, of bigger than a single group, multiple groups. And I couldn't think of a better way to introduce this than with your very own theme of 10 at the top, of 10 counties in the upstate region, of the 10 at the top community at large. So let's go to the next slide and dig into each one of these systems here. When we study and understand the system of self, what we are involved in is letting each person and each individual figure out who they are, how they introduce themselves. Do you go up to a person and say, I am, and you introduce your name, and then you identify your occupation, or do you identify yourself by degree? Do you identify yourself by your favorite activity? Or do you do a kind of a hold back a little bit and wait for someone to come up to you to ask who you are? Your sense of self, your sense of identity is typically phrased by the statement, I am, and then you would fill in the blank from there. The second area of self that people need to understand at a systems level is that of what an individual wants. So in this time of enforced social distancing or keeping ourselves rather isolated or quarantined, it's a really good time for us to become aware of what each of us want. What do we want right now? And when you fill in the blank, I want food, or I want to go hang out with my friend, or I want to be with people. It's important to take the time to be aware of what it is that you want, because this is important to your sense of self, to to the system of self. But it's very different from what you actually need. So in this time of distancing that we are engaging with, having a sense of spirit, of being aware of what it is that I need. When you are in states of quiet, that recognition of, I might want to be over here doing this, but what I actually need is to be doing something differently. To the extent that you can be aware and working toward what you need in addition to those aspects of your life that you want, and as they influence the way you identify who you are to the world, it will help connect you to those all-important emotions and the way that we feel. Sometimes we're not really aware of this, by the way, but our emotions are quite contagious. So if our emotion is one of panic, we tend to breed panic. But if we are in a state of confusion, then people are going to read that confusion and they feel that sense too. But to the extent that you have a very clear system of self, then you will recognize, oh, I feel panic right now, but I won't feel panic tomorrow. Panic may be necessary to adjust or to be aware of what it is that I want, but when I can reflect just a little bit, give myself a little bit of time, then I recognize that what I need is very little, and that is important to that system of self. So next slide. This leads us to our third mental health tip, which is understand yourself. For the sense of self, understand yourself, and that will contribute to your mental health overall. Next slide. So let's address the other area of our mental health systems, and that is considering other individuals, the system of others. When you are within chat rooms, for example, you're not alone. You are trying to understand other individuals as they identify themselves. They are members of 10 at the top. They are members of individuals working in organizations located in the 10 counties in which you are serving. They identify themselves as individuals who want to move the community forward. When you understand that that's what people are seeking, you help contribute to overall mental health for others. So that causes you to have to be aware then of what other individuals want. They want to have security. They want to have stable incomes. They want to have protection. They want to have jobs which are going to be there when all of this is over. Or if their jobs have impacted them by exiting their lives, they want to know that there is something else that's going to be just as important, just as engaging, and just as reassuring. And that's what everybody in this group is working toward. Strength, economic strength, occupational strength, occupational opportunities. You are aware of what they want. Your awareness contributes to the system of others. Your awareness in that system of others contributes to mental health going forward. You also have to be aware of what their needs are. People don't want to change generally. Our immediate human reaction is that when change is unplanned, we're going to resist it. When change is forced on us, we tend to resist it. But when we've had a little bit of time to reflect and to get a little more familiar with it, and we recognize I have to have this is what I need, that is what I want, then you are able to move forward a little bit more and be aware of that. Finally, in the emotions area, by having the system of others developed to the point of identity, awareness, and spirit, that contributes to your ability to read their emotions, to recognize what they feel, and then to help use those emotions in a positive manner. Okay, next slide. So that leads us to our fourth mental health tip, being able to empathize with other individuals. interesting, when you get to the tip, it takes very little time. It's all the background that builds up to it. Next slide. And finally, our system of community, contributing to mental health going forward. Recognizing, now you notice how I've changed the pronouns here from I to they to we. The same concepts are here. We are. How do we identify ourselves? We want, being aware of what we want to move forward. We need to feel in particular areas. So what does the community at large feel going forward? We take each of those, and you will notice I do have a tendency to be a professor and go on. So I'll try to control myself just a little bit to stay within our time frame. So next slide. That brings us to our fifth mental health tip. Facilitate the we. Build strength in others, build strength large scale, and everybody has positive mental health outcomes as a consequence. Next slide. So here are the 5 for you. First, recognize mental health and physical health are inseparable. Don't try to understand them separately. Work for them collaboratively, collectively, and both benefit. Second, learn individual mental health systems, and those mental health systems are understood at an individual, a group, and a larger community area. So that leads us to the third, be self-aware. Fourth, empathize with others. And fifth, facilitate the we. So you might want to know what individual behaviors you could do. Next slide. And I've given you a list summarizing right here. Now, these are the kinds of things that you can pull off the internet at large, and I've tried to organize them within that framework for you so you understand why they work and why they continue to recommend them. I'm not going to try to go over each one, but I give you these, and so you can take them away. And if you want to reach back to me later to ask individual questions about them, I'll be happy to spend time with you in that regard, one-on-one or a group or in the community at large, whatever you would like. Next slide. So I thank you. I thank you for these last few minutes, and I hope that if you have any other questions, that you will reach back.
Well, Beth, thank you so much. This is obviously such an important component of the pandemic, and one that often gets overlooked is how individually and then collectively we are thinking about the health of our employees, of our community holistically. And I think it's going to be critical moving forward to pay attention and do what we can to make sure that we are thinking about how the actions that are being taken impact everyone and what the reactions are to those. So thank you so much for sharing. Before everyone asks, yes, we will be putting all this on the website and sending it out as a follow-up to everyone as well. So Beth, thank you so much.
You're welcome, Dean. Thank you for having me.
And next on our agenda is someone who has been a friend of mine and a friend of the organization since not too long after we got started. Tim Todd is the executive director of Discover Upcountry and is one of the big advocates for tourism and exploring the upstate. And I am appreciative, Tim, for you to come share a few minutes about what's happening around tourism here in the upstate.
Okay, thanks, Dean. Thanks for having me with you today. I'm trying to figure out why you put me on the agenda immediately after the mental health expert, so I won't try to read too much into that, but I did kind of wonder about that. So anyway, I want to talk about obviously we'll have some bad news first, but as I go along, I hope that the news gets progressively better. And we're seeing some good signs as far as tourism things around our area and around the state and around the nation. So I just want to hit some high points and see if there's any questions or comments to add to that. But Dean specifically asked me to talk about just kind of overall tourism, but also with regard to hotel and lodging and restaurant sectors. So I'll go into that a little bit. And then again, some good news to end up with, hopefully. Some of these unfortunately kind of bad statistics come from our state tourism office and the Restaurant and Lodging Association, the State Restaurant and Lodging Association. But so just to give you an idea, from March 1st through April 25th of this year, our visitor spending in this is statewide, was down 44%, or $1.6 billion in visitor spending. January and February were good, at least according to, compared to last year and so forth. And up until about the second, third week of March, it was all looking pretty good. But from the last 6 weeks on, as we all know, it's been primarily bad news. The expectations, at least at this point, from the experts and the people who have been doing research and looking at everything, is that we'll probably be down about 50% for the year, because even when things come back, and hopefully sooner than later, they're still not going to get back to the levels that we were. So we're probably going to be down about $7.5 billion in visitor spending for the year in South Carolina. International travel is expected to be down 90% for the year, and I don't think that's probably any surprise to anyone either. In the first quarter, or actually through, I guess, the first four months through April, and again, all this has happened in the past 6 weeks, basically. Estimated job loss for South Carolina in restaurants and lodging sector has been 180,000 jobs lost. About 156,000 of those in the restaurant sector, about 24,000 in the lodging sector. Again, as things get ramped back up, hopefully a lot of those will come back. Many of those will come back, but again, probably not to the level they were. Particularly on the hotel side, year to date, so from January 1 up through April 25th, one of the hotel factors where how they measure their success, RevPAR, revenue per available room, was down 39.5%. The room nights sold, so just total number of room nights sold in the state, was down 26.8%. So in 2019, there were the same time period, there was about 275,000 room nights sold. This year, 201,000, so down quite a bit. A lot of hotels have been closed, or a number of hotels, probably got to about half of the hotels were actually closed in the state at one point, either voluntarily or by local order. So a lot of those were in Myrtle Beach. So Myrtle Beach, when they closed down, that closed down quite a number of hotel properties. So the numbers are skewed a little bit because of that. But the hotels that have been up and running were only running about 15 to 20% occupancy. Again, for that period, normally they would be about double that, somewhere around 40% occupancy on average. So to get started ramping back up, the South Carolina Restaurant and Lodging Association, State Tourism Office, Parks, Recreation, Tourism, and the Accelerate South Carolina group that Governor McMaster assembled a couple of weeks ago are working on guidelines, recommendations on what is and will be the new normal for how lodging operates, and then also for restaurants, kind of the same types of things. So again, the new normal for a lot of hotels, there may not be valet parking. There will most definitely not be breakfast buffets if we've done them in the past at our Hampton Inns and Holiday Inn Expresses and so forth, things like that. Probably not too many bellmen. You're probably gonna have to carry your own luggage to your room for at least for a while, and there will be limited contact with check-in. There will probably be even more people using online check-in app, or through the apps like the Hilton app or Hyatt, Marriott, all those have apps now to do check-in where you don't even have to stop by the hotel and your phone is your key to your room type thing. So I think you'll see more of that in the future. So it will obviously be different, but they are working diligently to get those guidelines and recommendations out. And those, I think the restaurant guidelines are out now, but the hotel ones should be coming next week, I think. As most everyone knows, and a few of you sounds like have tried it, outdoor dining started on May 4th, this past Monday. That's been going fairly well, and from what I've heard so far, it's a big adjustment in certain communities. I know Spartanburg did something I think was very smart to block off part of the downtown area for outside dining. And so things like that, people have gotten creative to do to try to capitalize and make the best of that situation. Probably most likely sometime mid to late next week, from what we're hearing, inside dining may be back, or at least the option to be back. Some restaurants will probably choose to take a little bit longer to get open. But again, the new normal is not going to be crowded restaurants anymore. It's going to be more people spaced apart. There probably won't be condiments and things on tables as in the past. The menus may be printed off and handed to you, to disposable, if you will, or you'll look up the menu on your phone or tablet as you get into the restaurant. Tables will be spaced probably farther apart, 8 feet or so apart for the most part. Groups of 8 or less in most cases. So things like that will be what you will see in restaurants. And but I think people are ready to get back. So hopefully when they do get back, a lot of these restaurants can start hiring their people back and getting back to business. So that's already a little bit of good news. A little bit more good news. The State Tourism Office has kind of had to change and tweak their marketing and advertising. So they've developed a recovery plan. So basically they will be marketing to a 350-mile radius of South Carolina, plus Ohio. Ohio is such a big market for South Carolina, particularly the coast. So that will be where they focus their marketing and advertising activity for the next foreseeable future anyway. Another bit of good news is actually website visits and particularly social media engagements, both for the state and for our organization, are up right now, or at least at the levels that they have been. So, but in some cases, so hopefully that means there's pent-up demand. People are ready to travel as soon as they're able to feel comfortable traveling, and but they're not going to get on a plane. More than likely, they're going to get in their car and they're going to go 100 to 200 miles away. And for our organization, for the leisure travel market that we try to attract, that's what our market is anyway. It's Atlanta, it's other parts of South Carolina, it's northern parts of Florida, Tennessee, and kind of the western North Carolina area. So for us, we're not going to have to tweak as much as the state, and that's good news for us. The other organizations I've talked to are kind of developing that same strategy and working on that same strategy. And our state tourism organization came out with dream now, discover later kind of themes. So we're putting a lot of content out there and things out there on social media, on our websites, and in the digital market to say, you may not can visit this week or next week, but soon you'll be able to visit. So get ready to plan your next trip when you do come up. So hopefully that we'll start seeing some people showing up into our campgrounds and hotels and bed and breakfast. The short-term rental market of VRBO and Airbnb are probably going to do better than some of our hotel properties, frankly, at least on the early part, just simply because they can have their own space and not be in a communal space like hotels and hotels, motels. So the bad, another little bit of bad news amongst the good, the group market though that we don't know when that will be back and how that will come back, because sporting events, meetings, conferences, conventions, we're obviously trying to figure that out, but it's going to be a little bit slower coming back. So, but individual travel, I think we'll see a good comeback on that pretty soon. Our state parks reopened this past Friday, and that's been going well so far. Again, because of the pent-up demand, I think a lot of the parks have had to close. They've limited their capacity and attendance at the park. So by lunchtime on Saturday and Sunday, about 6 or 8 of the parks in the upstate had to close the gates and not let anyone else in. So that's kind of good news, bad news at the same time, because it's good news that so many people do want to come out and visit our state parks and do activities, be outdoors. But the floodgates sort of opened on this past weekend. So hopefully that'll kind of calm down and we'll be a little more balanced in where people go and how much they get out and so forth. Some of the areas of the parks are not open though, so picnic shelters and community buildings, things like that, are not open. So just because the park's open doesn't mean the entire park is open at this point. Our welcome centers also reopened. They had been open, but only they had a note on the door and people could pick up the phone and call when they got there and ask questions and get feedback and information. But now they can actually come inside, but there's social distancing and barriers and things like that. So so anyway, that's I'm getting a nod from Dean with the hook. So that was at the end of my presentation about anyway, Dean. So I will stop there, and unless there's any questions or any comments, I will mute myself and listen on the rest of the chat.
No, that's perfect, Tim. And if anyone does have any questions through chat, Tim can answer those as well. It does seem a couple of things, Tim, that, individual experiences as opposed to more of the event kind are going to be the focus for most folks now. And as you said, the upstate is very well positioned in that area. And I think a lot of the creativeness of individual restaurants and communities like you mentioned Spartanburg, I think that's going to be interesting to see. So thank you so much. And we will have links to Discover Upcountry and others on our site, and we'll continue to keep an update and a look at tourism. So Tim, thank you so much for being with us today and giving that update with some good news, not all bad news. So that is important. Next, here real quickly from Katrina Carlisle. And for those who don't know Katrina, she is the executive director of Greenville County's Meals on Wheels. She has been a great partner of ours and involved in the senior initiatives for 7 or 8 years now with 10 at the Top. And there is an exciting new collaborative state senior meals program that it has come into play this week. And Katrina, we appreciate you sharing a couple minutes about that.
Thanks, Dean, so much for giving me just a few minutes of time to share. We are excited at Meals on Wheels of Greenville to be able to have this program come to Greenville County. We are one of 15 counties that is participating. It's an emergency senior nutrition program, and it's in partnership with Senior Resources, which is out of Richland County, and Blue Cross Blue Shield of South Carolina, who is funding this initiative for the next 5 weeks. And what it is providing seniors in Greenville County, 60 and above, with a 5-meal frozen pack, along with this week it's had some great fruit. And so what we are doing in Greenville County, we started this week with 3 sites, focusing on rural areas that what we've been hearing have limited resources in comparison to more concentrated areas in our community. So we are in Ware Place, Fountain Inn, and Berea, and I'd be glad I've shared the flyer. But it is a drive-through system that seniors can come through. There were kind of the criteria: anyone who's 60 and above, a resident of Greenville County, and all we're getting a name, address, and a date of birth. And so individuals can come through, we take their information, they drive through, get the meals, and so they don't have to come out of their car, which is great. We're at each one of these sites once a week for the next 5 weeks. It really is when we heard about this program that started in Richland County. While we have strong support of programs like this through Meals on Wheels and also Senior Action, we felt there are a lot of seniors that as this virus these are the most vulnerable. This is a program for seniors that maybe had never had to access some of the other resources in our community, but they need to definitely shelter in place and stay safe. So we were excited when the opportunity came up. It came up very quickly, learned last Wednesday that the funding had come through, and so we confirmed and implemented and started this past Tuesday in Ware Place. So it's definitely, something we hope is going to be benefit to seniors in our community for the next 5 weeks. And, if there is still a need, depending on kind of the unknown for this crisis and the challenging times, it may be longer. We're just not quite sure. So if there are any questions, I'd be glad to answer. And Sharon, I've sent you the information. So if anybody would like that, it's on our social media, it's on our website, and be glad to share the flyer for anybody.
Great, thank you, Katrina. And as she said, we'll make sure that information is out. And this is a great opportunity. And thank you to Meals on Wheels for being able to be part of that and ensure folks who are, as she said, maybe not traditionally the folks who have participated in these programs but are in need during this time. So I think that's really important. Next, real quickly, Aaron Oots, our entrepreneurial ecosystem guru. Aaron, give a commercial about your last, as I mentioned before, virtual workshop for at least the current series coming up this next Tuesday, and then the next event you have hopefully in person in June. Aaron. Oh, I guess oh, there she is.
There we go. Sorry.
Okay.
Being all prepared and unprepared at the same time. But thank you again for letting entrepreneurship be part of the agenda. The more we have these webinars and the more we learn, the more we realize that the saying that the support providers are the healthcare workers of the economy, it's starting to look like we're going to have to do a lot of resuscitating with our businesses and entrepreneurs. But this past week, we learned from Scott Baer, who is the chair of the Department of Economics at Clemson University, about kind of how we got to where we are from an economics perspective, and how it compares to other shocks to the system, and kind of what are some things we need to think about going forward. But this upcoming week, after listening to Beth talk about our sense of self and sense of others and sense of community, that's essentially what we're going to do. We're having a roundtable discussion of folks who work with entrepreneurs and asking them questions about, what are they seeing out there? What are their entrepreneurs saying that they want? What do they say that they need? What do you need as someone who supports entrepreneurs? And so that we can start to define what other resources we can put together at 10 at the top to present at our June meeting. We generally meet quarterly, so now we are planning for a June 25th meeting, hopefully to meet in person together and present some of the tools and resources that can help all of us, help all of our entrepreneurs wherever we are in the 10 counties.
Perfect. Thank you, Aaron. Now for our county updates. As you can see, we have a couple in person, then Sharon will give a brief update. First is our great friend and partner, Amanda Munyon, with the Lawrence County Chamber of Commerce. And I get a lot of her updates. And Amanda, thank you for taking the time, because you have been as busy and as much of a go-getter as anyone. So thanks for sharing a couple minutes to give us an update of what's going on in Lawrence.
Absolutely. Thank you so much for giving me a couple of minutes. First, I must say that I did listen into the entrepreneur workshop on Tuesday. I guess it was all my days. I think like many are running together at this point. It's fantastic. I hate that I missed the previous ones, and I definitely plan on signing on the next time. So thank you for putting that together. It rolls perfectly into what we're currently working on as a local chamber of commerce. With a lot of businesses that are really struggling right now, we are in the process of working with different groups. Teamwork has been amazing. Our county, local Main Street organizations have worked very hard together to try to support everybody in various roles. So it's been fantastic building those relationships in that way. But we're putting together a business recovery plan is kind of what we're calling it. It's not finalized at this point, but we worked with Main Street, Lawrence, and Clinton and put out a survey to our residents, the customers that we're expecting to go back into the businesses to see what they had to say and at what level they'll be comfortable with what, whether it be they expect people to wear gloves or masks or there to be plexiglass screens, what it is that they're looking for that will make them more comfortable about going back into these businesses whenever they're able to open and prepared to. So we're looking at, so of course, supporting our businesses, mobilizing for financial assistance directly, which we all, I think, have been working in that way with the different grants and such going on, but then also strengthening our businesses through various workshops and different things, a lot of what we're connecting with you on to make sure that our businesses are doing the very basics. I mean, just like make sure your contact information is easily accessible for people. It's some of the most obvious things that, we're trying to work one-on-one to make people aware of, because they're in the grind just trying to survive at this point. And sometimes they're missing really obvious things to others. So, and then of course, engaging our community and trying to change that culture and way of thinking to encourage them to think local first and make sure that they're purchasing anything they possibly can in the local businesses, whether it be through online purchasing or directly in those businesses, but once more to make sure that money, income stays to support our local efforts. We are starting some, we're calling it business boost videos tomorrow, where we're going to go in some of these stores and do some interviews, get to know your entrepreneurs, kind of hear from them one-on-one about what their struggles are and what they're doing to adjust to the times. So, you know, we're just working really hard. Appreciate all the ideas that we see coming from various directions, because I definitely think that we have to continue to rally around these businesses and do all we can to support them.
Great. Well, thank you, Amanda. And their website and was it Shop Local and
It's Think Local Lawrence County.
Local Lawrence County has been just, you know, everywhere. So, you know, a great model and an example. And thank you for that, Amanda. We're going to do a quick flip and have Hannah Jarrett with the United Way of the Piedmont give an update for Cherokee, Spartanburg, and Union, and then come back to Joe Keitha Seabrook here in a minute. So Hannah, appreciate you being on again, and an update for what the United Way of the Piedmont has going on in Cherokee, Spartanburg, and Union.
Thank you. Do y'all mind if I share my screen?
No, you're good.
Okay. Oh, well, it says it's disabled, so I'll just give a verbal
Justine
report.
will-
That's fine.
Justine, can you do that for her?
Done.
Thank
Okay,
you.
try now.
So in Spartanburg, Cherokee, and Union County, we have what we call the United for All Fund. We've raised over $324,000 for the fund, and it is specifically to help people in our community, Spartanburg, Cherokee, and Union counties, as they deal with job loss, being in furlough, having their hours reduced, helping with paying rent and mortgage, utility, and in some cases, motel stays for people who are living in motels. We are using 211 as our coordinated entry system. So anyone can call 211 or fill out a form on our United Way of the Piedmont website to let us know that they've been impacted, how they've been impacted, and what their needs are. We've had over 266 households already reach out since the last week of March, primarily in Spartanburg County. We're working on more ways that we can raise awareness and make sure folks in Cherokee and Union County know about the resource. We've helped 132 households across the 3 counties with financial assistance through the United for All Fund, spending over $111,000 already in financial assistance just in like the first month of providing this. Most of the assistance has been in rent mortgage, with over $67,000 in rent mortgage across the 3 counties, followed by utilities and then motel stays. One thing that's been interesting that I know I've mentioned before is that the majority of people who are reaching out, this is their first time ever reaching out and seeking assistance for safety net services in our community. At 59% people reaching out for the first time, an additional 26% haven't asked for assistance in over a year. So only 15% of those that we're helping and serving and who are reaching out are frequent users of the safety net system. So that's been a new population that we're working with. At this point, with the funds that have already been raised and secured, we have what we estimate about 6 weeks more left in our funding. But we are continuing to fundraise, and our goal is to raise an additional $120,000 to $150,000, which would allow us to hopefully continue to help the community for 3 more months, because we do feel like there is going to need to be long-term assistance for families. We did think that this week we would see less people reaching out. Throughout the month of April, we were having about 1 person reach out every hour. And we expected that to decrease this month, knowing that people were receiving their stimulus and maybe their unemployment had finally gone through. But this week we're seeing 2 calls an hour. So we've doubled the people who've reached out in this month. Just between Monday and Tuesday, we provided $20,000 worth of assistance. So the need's still out there. A lot of people who were put in furlough were expecting to go back to work this week, but now that is not the case for most people. So their situation is just extending, and they're having to reach back out saying, I still don't have a way to pay my bills and to keep the lights on and a roof over our heads. So, and also the moratorium on evictions is lifted on the 15th. And we have already started to see some of the negative impacts of that. We've had people with $2,000 bills that have accumulated over the past several weeks, I guess 5 or 6 weeks, because of the moratorium, and they haven't been paying those bills, and now they have really large bills that are all of a sudden due. So that's my update. I am happy to answer any questions through the chat if y'all have any. Thank you for this time.
Great, thank you, Hannah, appreciate that. And I know in Greenville County, they have launched a similar program, and so I appreciate having Joe Keitha Seabrook with us to give an update on what's happening here in Greenville. Joe Keitha?
Fantastic. Thank you so much, Dean. And again, thank you guys for allowing me to be here. I kind of was excited for going after Hannah because she kind of explained a lot of what was going on. So I could just say ditto and then just back off. So United Way, of course, in Greenville County looks a lot like Greenville, the Spartanburg, the United Way of the Piedmont and Cherokee and Union. We are also fundraising right now. We have reached our $1 million mark here in Greenville for funds that were raised. We too have done some grants that we did. What we decided to do was we did food first because we knew that folks would need food immediately. And so we partnered with the school district here and we tried to go to some of those sites that they were not able to get to try to help with the food first effort. And of course, folks like Meals on Wheels, Loaves and Fishes, Homes of Hope, Project Host, were all, and Harvest Hope were all part of that first kind of round of folks that came through. The other thing that we found when we were dealing with Food First is later on it came out that there was a huge deficit in the Hispanic community, where there was even more fear of folks leaving their homes, going out and accessing some of the benefits and some of the food items. And so we started up a Hispanic network where we have also given funding out to some local churches that are very familiar with the Hispanic community to make sure they felt very comfortable going to places that they frequent themselves. And we also tried to get some information out to make the food boxes that were being given out to the community a lot more sensitive and culturally sensitive to the folks that would be receiving them. And so to date, out of the 1 million, we have granted out $367,000 that went out. That was not all Food First. The second half of that was Housing Next is what we called it. And that is where we knew the same things that Hannah talked about just a second ago. There are people that have been chronically homeless, and then there's folks that are just now experiencing that. And so we got with folks like United Ministries, United Housing Connections, with the city and the county, Human Relations Commission, Community Works, and Share to come up with a larger coalition to kind of help with different things. So we have everybody calling 211 exactly the same way that you do with the Spartanburg, with the United Way of the Piedmont. The thing that was just a little bit different about ours is that we brought our 211 for Greenville citizens in-house. And so we actually have our AmeriCorps members that are actually filtering those calls, and they're doing a little bit of case management. So it's not just let me forward you to an organization. I'm going to stay on the line with you. And also we offer Hispanic calling that can translate once they actually get to someone on that phone. So we've tried to do a little bit deeper dive for everyone, all of the citizens here in Greenville. And so we're pretty excited about that. The housing program launched this week. We sent out last Friday, on Monday, we sent out a news release about that, all of this information of course, can be gained at United Way of Greenville County.org. And we've received, since we took in 211, we've received over 2,500 calls that were just Greenville centric, which says that there's a large need. We actually felt like May would be a little bit, we would start getting an increase, especially where housing is concerned, because this is when their moratorium is going to stop. And we kind of feel like that is really where the housing is concerned, is getting ready to ramp up quite a bit. And so we also have our 211 operators getting, learning from Appleseed to make sure they understand what tenants' rights looks like. So sometimes it's just knowing your rights and not just letting your landlord tell you you have to leave. And it's not always about getting funding for that. It's just making sure they know their rights so that they're not taken advantage of. So those are some of the things that are happening here at the Greenville County United Way.
Great. Thank you, Joe Keitha. And again, congratulations and thank you to all the service providing organizations and groups like the United Way and others that are really filling an important need during this time. And all of that information is also on the repository page on our site that we created at the beginning of this, and is in the links for things. So if you're looking for information for any of the counties in the upstate, you can find it on the repository. Sharon, I'll turn it over to you to share a little bit from some of the other counties.
Unmute myself. Okay. Whoops. Sorry, I lost my document here. Okay. I'm going to zoom through this. From Oconee County, we're trying to get one encouraging thing and one challenging thing. Annie Caggiano from Oconee did not even have anything challenging to give me. She said that her good news is that Borg Warner is back to production on a limited basis. And also today at 3 o'clock, they had a big announcement that Newry Mill had been purchased and was being developed into apartments. From Abbeville, Mike Clary from the city of Abbeville says he's been encouraged by the resourcefulness of many local businesses adapting to the current situation. Several restaurants seem to have been able to completely change their business model in order to stay open and relevant. Major challenge for the city of Abbeville has been the loss of revenue and loss of economic impact of the city's events on local businesses. The city has had to cancel the Spring Festival and over 15 shows at the Opera House, and the loss of that revenue has been a challenge. But perhaps the main challenge is looking towards the future, how to successfully manage the need to bring in people with a retail and dining economy that's largely based on tourism, with the need to keep people safe. From Pickens County, Cindy Hopkins shared from the Easley Chamber of Commerce, shared that the challenges that a lot of her businesses are sharing concerns about reopening. The encouraging thing that she shared was that she's heard from many businesses in the last couple of weeks that PPP funds have finally been received to help their burdens for the moment. And she said it's been nice to talk to businesses and hear a sense of hope in their voice. From Anderson County, Pam Christopher from the Chamber of Commerce in Anderson says the encouraging thing is that the leaders in our community have been working together to bring solutions for our business community and our citizens. From our elected officials to our state and cities, town administrators, school superintendents, and post-secondary colleges and universities have been coordinating efforts to answer the needs throughout Anderson County. There's more, but I'm gonna edit here. The challenge, she says, we still have businesses within our county that weren't able to access the grants and funding, and there's a great need in particular for our small business community, but we have efforts that are being worked on to address these concerns. She says we've got the draft of a recovery plan completed called Battle Plan Greenwood, and their first meeting of that task force was held on Monday. And the challenge is that unemployment claims have jumped from the low 300s on March 21st to over 1,000 last week. So that's from Greenwood. Sorry about that.
No, not a problem. And last, I do want to say, since I think Angela is on the call to hear the bad news from a couple weeks ago that she's leaving us, but we are glad she's still here with us, and we appreciate everything she has done and her support throughout the years. So with that, Terrence, we will turn it back over to you to wrap us up. I will say next week, I'm really excited. We have our two sector speakers are going to be Liz Seaman, who is at Furman University, to give an update of Furman, and then also she is on the Greenville County Economic Recovery Team, so she's going to talk a little bit about what's going on there. And then we also have John Lummis with the Upstate Alliance to talk more holistically about economic development and its role as we move forward. So I'm excited about next week, and we'll again have our county updates and things as well. But with that, thanks to all our speakers, and I'll turn it over to Terrence to wrap us up.
Thank you, guys. Thanks, Dean. Every time on these calls, I hear about the great things that are happening in our communities and best practices that we can take back to our community. With the challenges that we still have ahead, I believe that by working together, we'll continue to prosper. Hope everybody has a good Friday and relax. Enjoy I think it's going to be cold, but let's get outside and enjoy ourselves. Support local. Have a good day.
Thanks, everybody. See ya.
Bye.
Bye.